Good afternoon, everybody. I'd love to welcome you into this afternoon's webinar. My name is Rachel Ennis, and I'm a committee member for the Public Services Community, formerly the Public Services Group. So we are one of 18 interest-specific groups available to IOSH members, and we represent about 8,000 IOSH members who work in or have an interest in the public service. So our members work in the blue light or emergency services, local government, central government. They're even consultants or private companies that are contracting into the public sector. So for myself, my background, I'm a certified member of IOSH, and I'm currently an occupational health and safety advisor at the Department of Justice in Ireland. And in that role, my team and I get to work with colleagues who engage in all aspects of criminal and civil justice. So for our service users, our clients, our customers, we meet people who are at some of the most challenging points in their lives. And from a workplace risk management perspective and an employee safety point of view, that can put some very complicated risks onto our risk registers, particularly where psychological health and safety is concerned. So my department's probably not alone in that. It's certainly challenging to pop those hazards onto our risk management system, and especially when you have a statutory duty to deliver the work. So where are we better to start off with in exploring the international standard ISO 45003? So I'm delighted to introduce all of you to our speaker today. Kate Field is the Global Head of Human and Social Sustainability at the British Standards Institution, BSI. And Kate, you're also a chartered member of IOSH and IOSH alum. So thanks for joining us today and giving us a bit of a foundation in 45003 and what it might take for us to integrate these into our health and safety management systems.
Lovely, thank you, Rachel, and hi everyone. It's great to be here. So yes, I'm a long-standing member of IOSH, as Rachel says. I'm lucky enough to have my chartered membership. I've also worked for IOSH in an IOSH corporate role, as well as being a council member, in terms of feeding back and contributing back as an actual member. So IOSH is very close to my heart. Always delighted to come back and present and support IOSH members and fellow health and safety professionals wherever you happen to be in the world. And I think we might have quite an international flavour for today. So thank you. Let's see if I can get the technology to work in terms of sharing screens again. And we can get going with the presentation. Now I'm gonna I'm gonna go straight in with a kind of an apology to everyone. I love talking about this subject. It's something that's incredibly close to my heart. But there are two challenges. Everybody's understanding of this subject is very, very different at the moment. Some people have quite a good understanding. Some people it's almost completely new. So it's always a bit of a challenge in finding kind of the right balance in a session of this type. So I try and cater for both, and hopefully everybody goes away with something. Some of it might be new, some of it might be familiar to you, but hopefully everybody will take something new away. I think a lot of people aren't that familiar with 45003 still, so hopefully you'll come away with a better understanding of the standard. The other apology I like to make right at the beginning is particularly when I do IOSH sessions, I try and actually put a lot of information in the slides. Now, I'm not going to go through all of that information in this webinar, but I do that so that you will get a copy of the slides and then you have that information available at your disposal, you know, so to go back to and refer to and kind of look at anything we didn't cover, because I like to equip you with kind of as much information as I can in the time that we have available. So I'm going to start with kind of a basic point, just to kind of hopefully make sure that we're all aligned, and that's about actually what is stress. When we talk about psychological health, and we might talk about work-related stress or burnout, all of these different terms, or sometimes obviously within this context mental illness, not everybody understands actually what stress is and why it can be a problem. So I like to just kind of give us a benchmark there. So stress actually is a really amazing thing. It's our body's natural defense system. So it's built into our DNA. It comes from the days when we were cave people, and we were having to fight for survival or for our dinner. And it's basically what was often referred to as our flight or fight response, or fight, flight, freeze, fawn. There's more F's being added to it, but fundamentally it's that inbuilt fight or flight response, which is designed to keep us safe, and it kicks in automatically. We don't have any control over it. Quite often we're not even aware that it's going on, and it has a really kind of a cascading impact on our body. That in simple terms, there's a big release of chemicals. Those chemicals then do lots of different things to our biological system. Sorts of things it does is it increases adrenaline, gets our muscles ready so that we can fight or flight, as an example. But what's interesting, as we go into that fight or flight response, it kind of prioritizes resources. So it puts all of our energy, all of our systems that are going to keep us safe on kind of high alert, and then it starts to take away stuff that's not essential in that moment. In the short term, when we need it, it's great. It is that thing that keeps us safe. The challenge with that stress response is that if it becomes excessive, if it's repeated over a period of time, we have very high, kind of a very significant stress response and a traumatic effect, it can actually start to create harm. So it's a really interesting sort of biological function. Great in the short term, problematic when it's repeated in the long term. And the sorts of things that we start to see in terms of the sort of the impacts where we have too much stress is kind of if it's acute. So in a moment of stress, or a particular traumatic events, then it has kind of effects around our mental and cognitive ability. So we might feel more nervous or anxious. So when I'm presenting, I'm actually always having a mild stress response. My adrenaline's up a little bit. I've got slightly sweaty palms, because actually kind of stress, when it's a good thing, can help us perform better, like present. It can increase our emotional reactions, so we might be quicker to anger or sadness or crying, also all of those sorts of things. It can impact our cognition in terms of confusion, indecision, poor memory, sort of loss of motivation. It has this cascade of physical effects. So I mentioned things like flushing and sweating. We can feel run down. We have that muscle tension because our muscles have gone into that, get ready, we've got to do something. Everything comes tight. And really interestingly, if you start to notice this, it has an impact on our breathing. So we quite often will sigh or huff and puff to try and regulate what's going on with our breathing. So it's an interesting sign once you start to pick it up. And then, of course, we try and cope with the stress, and quite often that will have kind of impacts from a behavioural point of view. So changing our eating habits, eating more, eating less, changing our sleeping habits, sleeping more, sleeping less. We might use alcohol, drugs, nicotine to manage the stress. And often we don't have the energy, the resource to manage our appearance. We tend to let our appearance go. So that's the acute, that's short term. But if this is repeated over the long term, this is when it can start to have really significant implications for our mental and our physical health. So from a mental point of view, it can lead to anxiety, depression, post-traumatic stress. Physical implications, things like irritable bowel syndrome, cardiovascular disease. It really impacts our immune system. It can have an impact on our musculoskeletal systems, increasing risks around things like osteoporosis, increases things like eczema from a skin point of view. And again, from a behavioural point of view, if we're adopting these coping mechanisms, then they can have impacts. So if we're eating too much, it might lead to obesity. If we're not eating enough, emancipation. Sleeping, then again, insomnia or diabetes, and issues around potentially addiction and overdose. So I like to give that kind of quick rundown so that we're all at a starting point about what stress is and why it can become a problem where it's repeated over a period of either a period of time, or we are exposed to a very significant stress event. So let's start to put it in a little bit more context. So I want you to have a look at this list and kind of, you can tick off in your mind or count on your fingers, how many of these have you experienced? Have you ever been worried about your job, been through a restructure, kind of disengaged because you don't think there's any career development opportunities, you felt isolated or unsupported, you feel unappreciated, you've missed a child's event because you're working, you've experienced bullying, harassment, discrimination, you've been accused of bullying, harassment or discrimination, left a job because of a line manager, been frustrated by micromanagement of a line manager, had no idea of what's expected of you to succeed, caught in the middle of clashing behavioural styles, afraid to make suggestions or raise ideas, had inexperienced line management, felt overwhelmed by work, had that butterfly feeling or feeling slightly sick on a Sunday night before you go back into work on a Monday, been in a negative competitive environment, seen leadership cliques and favouritism. Now, I'm guessing that a number of you have experienced a number of those. You might even, if you've been doing it on your fingers, probably have used both hands to get through that. Now, each of those is a workplace psychosocial risk. They are a potential form of harm that can lead to stress and the negative impacts of stress. So it starts to put it in context. And I think one of the things that actually I think it's one, people get really worried about kind of looking at psychological health and safety. People think they need to be a psychologist, or that it's something really complex or difficult. But the reality is we've all experienced it at some point in our lives, in our working lives. Hopefully never to an extent where it's had a really significant impact on our health. But some of us will have. I've certainly experienced work-related stress in previous roles. But by putting this list out there, I think it starts to help us understand that this is something that we all experience, and therefore we all have an understanding, and that can be really helpful when we're thinking about it from health and safety point of view and what we need to do. So if there's a problem with psychological health and safety in a workplace, are there any signs? And I've always found this really interesting, is I think you can see it and sense it in a business if it's a significant problem. I almost can walk into a workplace and be in there for a few minutes, look around at the people, look at how they're interacting, and get a sense about whether psychological health and safety is an issue, whether there is problems around work-related stress. And it starts to be evidenced in different ways. So you see changes in people's behaviours. You tend to see sort of more isolation, with withdrawing, people refusing to help or go that extra mile. You get obviously things like increased absence from work, lack of engagement, reduced energy, higher staff turnover. It starts to impact, quality and performance in other areas of the business. There tends to be more conflict within teams, and also you tend to see things like more customer complaints. You might have increases in terms of people making complaints, bullying, harassment cases, all of those sorts of things, as well as actually increases in Mabel and in what we might call kind of safety, health and safety incidents and errors. So if you know what to look for, you can start to see whether it's an issue. And then, of course, what does that mean for your business? If you have got an issue with psychological health and safety, what impact is it's going to have? So it will restrict your business's growth. That's the bottom line. And that tends to come through because of kind of all of these underlying issues. So, you tend to have issues with quality and outputs, poor productivity. You've got that issue around talent and retention. You don't have the innovation or agility that you need to stay competitive. From a health and safety point of view, you get that plateaued or reversing health and safety statistics. Same from an engagement point of view, really interesting one. Again, those increases in complaints, increasing reports of stress, burnout, and mental ill health. So people will actually start to talk about it. So you'll tend to, what you might see is an increase in absence, but people might not be actually saying why they're taking that time off. They might say it's a cold or a tummy bug when actually it is a work-related stress. What you tend to see over a period of time is people will start to be more overt about talking about it. And then actually, people have enough and they want to get out. So you get that absence retention. But if they're coming towards the end of their career, they'll look for that early retirement option as a way out. So that gives some context about psychological health and safety, kind of what it is. So it's stress gone bad, if you like, over a period of time. It has an impact on our physical and mental health, and it creates issues for our organisation if it's there. So what can we do about it? Well, we can manage it in the same way as we manage every other health and safety risk. That's the good news. It's not something crazy different. You don't need to be a psychologist. You approach it in exactly as the same way as you do other health and safety issues, and particularly other health issues. And if you're looking for a framework to do that, then ISO 45003, which is the international standard on psychological health and safety management in the workplace, is a great guideline document. If I'm guessing quite a lot of you are familiar with international standards, they follow the plan, do, check, act approach. So, kind of planning, identifying what the issues are, getting leadership, getting the consultation and participation, then the doing. So, actually, what are you doing about it? Putting in your risk controls, then making sure that's all working in terms of the check, and then finishing the cycle in terms of if it's not working, acting, and then restarting the process. So this standard follows exactly the same principles as plan, do, check, act. And it's really, it's a great guide. It provides information on how to recognise psychosocial risks and hazards, and I'm going to go into those in a little bit more detail. It offers examples of action you can take, and we have a hierarchy of controls for psychological health and safety in the same way we do for other physical and health and safety risks. And one of the things that I really like about it is that in the document there are 3 tables that go through and list basically nearly all of the psychosocial risks that you are likely to have within your organisation. So it's a really great checklist to kind of work through and say, is this likely to be a problem for us? So it's really great. It was published back in 2021. It is voluntary, it's guidance, but it is designed for any type of business. So whether you are a large public sector organisation or a small SME or a construction business or whatever type of organisation you are, it is designed and can be a helpful framework. So let's go into it in a little bit more detail. So it uses this term psychosocial hazards. And I'm actually a big advocate of trying to get that term embedded into the terminology of a business. Work-related stress, I think, is a great alternative. But I think if we try and hide it under other phrases, well-being, mental ill health, it's kind of really missing the point that this is a work-related issue, and therefore we need to take work level action. So psychosocial risk factors are those factors that will impact a worker's psychological, so that's the psycho, and their social response to their work and their workplace. So basically things that are likely to trigger that stress response. And what's interesting is there is a relationship with other types of physical harm in particular. So psychosocial risk factors will increase some forms of physical risk. So a really good example of that is musculoskeletal disorders. So if you are doing a job that is heavy in terms of repetitive action or musculoskeletal disorders, if you've got stress overlaid that, because you've got that stress response where all the muscles tighten up, you're much more likely to increase harm, injury from a musculoskeletal disorder point of view. So there is an important relationship that we need to understand. Some forms of other health and safety risks can lead to psychosocial risks. So noise is a really good example of that. So if I was to say to you, imagine the sound of my nails drawing down an old-fashioned chalkboard. So some of you will know that, and some of you going, oh my God, that's a horrible sound. That is a stress response. It's a horrible sound. We go into a stress response. But we see it, if you've got a very high noise environment, or people who struggle with sort of loud open plan office environments are often having a stress response. So there is this relationship that we need to be aware of. But I think one of the biggest challenges we have with psychological health and safety and these psychosocial risks is that often the potential problems or issues are hidden because it impacts it has a negative impact in terms of human error. So I mentioned that, it affects our cognition, so our memory, our decision making, and those sorts of errors are often hidden or latent. If we are doing maybe a chemical formula and we transpose numbers because we're stressed, that might not become immediately apparent. It might only become apparent months, weeks, or even years later, and there might be a really catastrophic event as an outcome of that, but nobody will necessarily make the link back to that original human error and stress. So it's a real challenge, and it's something to be alert to. So in 45,003, it groups the psychosocial risks into 3 areas: work organisation, social factors, and then work equipment and environment and hazards. So let's have a little look at those. So work organisation, what sort of things is it including? So things like roles and expectations, responsibilities, job control and autonomy, job demands, organisational change, remote and isolated work, workload, work pace, working hours, working schedule, job security, precarious work, all of those sorts of things. And again, it's important to understand that often, as with other forms of health and safety risk, there is often a relationship. They're not standalone risks. So a good example of this is if there's organisational change, people will often be concerned about job security. So we can start to kind of see this relationship and build this picture. So that's work organisation. It's kind of the working structures and processes. Then the social side, as the name suggests, is perhaps more of the relationship side. So the relationships between people, line managers, team members, peers, different departments, working customers with the public. It tends to be those touch points that can create issues. Here and I think this is one of the really important things, is a lot of how psychosocial risk is managed comes down to leadership and culture. Culture is driven by the leadership. It's their attitudes and behaviours and ways of working. And therefore, if they are not alert to what psychosocial risks are, they can really create a negative environment and really create significant problems throughout the organisation. So again, that leadership awareness and buy-in is really critical. Things like recognition and reward. So not just about actually how much you're paid, but actually, does anybody say thank you? Is there any sense that anybody's paying attention and the work you're doing is appreciated? Hugely important. Things like career development, continuous learning, really important from a mental health point of view. We know that from other studies, and within a work context, if it's not there, if we don't feel that we've got that ability to learn and grow, it has an impact on us. Obvious things about support and supervision, again, within your working group, within your line management, all of those sorts of things. Then how people are treated, so things like civility, respect, violence, harassment, bullying, victimization all come through there. And of course, then overarching some of this is whether we feel we've got a balance in terms of our work and our life. And if we don't feel that balance there, that's a really significant cause of stress. So quite a lot. You start to see that there's a lot there. But if we think about it from another health and safety risk, something like chemicals, often we're exposed to a lot of chemicals. They all have slightly different risk profiles, and we need to work through them. It's the same kind of principle. So I don't want you to kind of feel too overwhelmed. Once you get your head around it, you start to kind of see it. And then we have this final group, which is I kind of think is the interaction maybe with other forms of health and safety risk. So I've talked about things like noise, lighting, musculoskeletal disorders, chemicals, temperature. If we're too hot, we're too cold, we tend to have a stress response. I've said COVID, but moving on, risk exposure to biological or infectious diseases. The equipment we have, I can assure you, and I'm sure I'm not alone, that one of the things that takes my stress levels from 0 to 10 in about 5 seconds is if my laptop starts playing up. So, those tools, the equipment that we use, have a really big impact. And then depending on kind of the nature of your role, and particularly, public services, as you heard from Rachel, includes emergency services or prison staff. If you're in a situation where you might be exposed to violence from other forms, that's obviously can have quite a significant impact on your psychological health. And if you're working globally, that can come out in other areas in terms of things like war or risk of kidnapping in some parts of the world. So that's an overview of what these psychosocial risks are, how they're grouped, what they are, what they look like. Kind of to start you thinking about where they might come up within your organisation. Now, if we look at public services, as Rachel said, it's quite a broad group. We know that a lot of public services, if we look at HSE stats, have by far the highest levels of self-reported work-related stress in the UK. A lot of those may be more public administrative, but then those who are working on, I'll say, frontline roles, so emergency services, prison staff, actually they have exposure to very significant risks, and quite often quite traumatic. So, we see that come through in some of the statistics around not just work-related stress, but also things like work-related suicides, where actually that mental health has had such a negative impact that people start to consider or do take their own life. So we can start to see that for some roles this becomes really life impacting. So again, it in terms of consequence for a lot of people, it can be fairly mild, but it can be very significant as well. And I'm going to come back to risk assessment and likelihood and consequence briefly in a minute. So for those of you who are UK based or use the UK HSE sort of stress management standards as your format, how does 45,003 align? So you can see it's kind of quite clear here. We've got HSE, we've got the 6 areas of work-related stress: demands, control, role, change, support, and relationships. So the first 4 link to work organisation in 45,003, and then the last 2 relate to those social factors. And I think really from an HSE point of view, and I used to work for HSE and I was working at HSE when the stress management standards were rolled out, so very familiar with them, did a lot of early training both for inspectors and for organisations who were adopting them. The expectation is that other health and safety risks that might have an interaction with psychological health and safety, they should be covered in your risk assessment. So if you've got a noise risk assessment, does it include anything about psychological health and safety? Does your musculoskeletal disorder, your MSD risk assessments include anything about the increasing risk if there's stress? If it doesn't, that's where you need to go back and start to look at your, if you like, your existing health and safety risk assessments and starting to look it through a lens of psychological health and safety. So context, kind of what they are at a very high level. So what do we start to do about it? So we can take exactly the same approach to psychological health and safety and the management of psychosocial risks as to any other form of health and safety. You don't need to be a psychologist. It's just about understanding the specific risks. I'm sure, and I think back to when I started, I didn't know anything about chemical risk. I didn't know anything about machinery safety. I didn't really know anything about work. I had to learn what all of those risks were, understand what the hazards are, what that meant in terms of risk, and then had to learn the controls. So it's a learning journey, and I think it's just it can feel more difficult. I think health issues can feel more difficult because they're maybe not as obvious, they can be latent, but the process is the same. So we identify and assess in pretty much the same way. I'm going to come back to that. You can use a quantitative type risk approach or qualitative. I think the only really big change when we're looking at psychological health and safety is that to do it really effectively, it needs health and safety expertise and you need HR. As with all sorts of health and safety management, you should have consultation and participation with really broad groups, workers, supervisors, leaders. It's the same. But when we're looking at particularly the risks and really specifically then the what we do about it, the controls, you will need to work very closely with HR because a lot of these will sit in the HR space. So that's the only real difference. So in terms of identification, hazard identification, and looking at the risk assessment, I've got another slide to go through where you can look for sort of for the hazards to signpost whether you've got an issue. But your risk assessment is the same. So the what are the hazards? Who is exposed? And again, just like with other forms of health and safety risks, different groups might have different levels of exposure and risk. So we need to take that into account. How often? So what's the likelihood? Is a work-related stress issue a once in a while event, or is it something that's fairly constant? What's the consequence for this? Again, duration has an impact here. So a short duration of exposure to stress, unless it's a very significant traumatic effect, probably won't cause a great deal of harm. A lot of the potential consequence and severity of harm is about duration or repeated exposure. So that's where you look at and making a judgment about consequence. Again, and that relates to then that acute or chronic. Is it short? Is it accumulative? Is it repeated? And we need to be aware in terms of dynamic risk, again, particularly for those who work in emergency or frontline roles, where there might be a particular incident or crisis and we might need to deal with that. So where do we start to look to see whether we've got any issues? So that identification, hazard identification. So I've mentioned already, start with your existing risk assessments. Do any of them talk about psychosocial risks? Look at the ones where we know there's a relationship, potentially chemical exposure, musculoskeletal disorders, vibration risk assessments, noise risk assessments. a lot of organisations, I'm sure some of you, particularly again for this sector, will have stuff, risk assessments about violence and aggression. Are you just focused on the physical risks, or are you thinking about the psychosocial risks? So great place to start. Job descriptions. Actually, what is it that people are doing? If they're up to date, you can analyze tasks, schedules, locations. How, you know, what hours are people are doing? Is it consistent? Are they taking leave? Talk to people. So the most important thing, that consultation and participation piece, obviously with your workers, employees, but others. You can look at performance evaluations, worker surveys, and worker engagement surveys. I'm going to come back to that. Other questionnaires, other audits, focus groups, interviewing, talking to people, really good. Going out, looking around, looking at accident data, all of those sorts of things are there. Other sources of data are really helpful here. I mentioned, things like overtime records. Are people taking all the leave that they should, the holiday leave, the vacation leave? If they're not, then that suggests there's an issue from a workload point of view. Exit interviews also can be really great. These days, there might be data that we are getting from apps or wearables, but we need to approach those with caution from a data privacy, and also actually how accurate and meaningful that data is. Obviously, guidance from IOSH, your professional body, but sectors, regulators, all of those sorts of things. But also if you've got things like a employee assistance program, or even if you've got kind of a mental health first aid program, you might have anonymized data that might signpost to whether you've got hotspots or particular issues in particular areas that can help in terms of prioritizing where to start. Are we doing for time? Okay. So then you've identified, you've done the assessment, then you need to do something about it. So the controls. So we have a hierarchy of controls, as we do with other forms of health and safety risk. In 45,003, they take from sort of the public health domain in terms of using terminology about primary, secondary, and tertiary. And it's about primary relates, if we're thinking about our traditional hierarchy of control, about the prevention, the stopping it or minimizing it. So it's, if you like, the eliminating, the substituting, or the engineering elements. Secondary are kind of all of those other administrative and training areas, and work organisation. Well, work organisation can be a primary, but it can be a secondary. And then personal protective equipment might sit in here as well. And then what's different, and if you like, the added piece from a psychosocial point of view is really the support factor. Perhaps once somebody has started to be exposed to a psychosocial risk and become ill or unwell with it. So tertiary tends to be that reactive piece. So primary and secondary is about being proactive and prevention. Tertiary is your reactive and support. So things like your EAP programs, mental health first aiders, absence management processes, individual risk assessments. Here in tertiary is also where some of the broader well-being activities might be supportive. I've pulled out financial well-being as a really good example in this space. We know that financial concerns have a really significant impact on people's stress, and therefore if you're able to support them and address that can be really beneficial. And then I've done a little silly picture. Kind of some of the other fluffy stuff tends to get dumped into this tertiary group, and I'm not saying that there's not some benefit for some of that yoga and yoga, but it's not about preventing psychological health and safety in the workplace. And again, what tends to be the focus for those things is on the individual and making us resilient enough to cope, rather than addressing the organisational root causes. And that's what we've got to do from a psychological health and safety point of view. These are organisational level risks, and they need organisational level controls. So a really good way to think about this, or to draw a parallel, would be something like fire safety. So fire safety in an organization, in a premise, is an organizational risk that impacts everybody who's in that premise. And therefore we have to take organizational premise level control. So have a fire alarm system, emergency lighting, fire doors, sprinkler systems, fire extinguishers. We manage it at a business organizational level. Now, there may then be some individuals who need some additional support, either on a temporary basis or more permanently, which is where we might do then a personal emergency evacuation plan. So if somebody, my partner is a good example at the moment, if they've got a broken foot and they're on crutches, then they might need a personal emergency evacuation plan while they are recovering. Other people might have a more permanent disability that affects their ability to respond in an emergency. So there might be a mobility issue, they may be in a wheelchair, or they might have a hearing disability, in which case they couldn't see a fire alarm, in which case you need to have a visual alarm to support them and the risk that that individual has. So it's the same, but we start at the organizational level, we manage it there, and then we supplement it if we need to at an individual level. And just to kind of finish the well-being piece, a lot of organizations have do a lot on well-being, and a lot of it is great, but most of it is not psychological health and safety, health and safety management. And often organizations think they think they're amazing at well-being, therefore they're amazing at psychological health and safety risk assessment. That is nearly never the case in my experience. But, and this is really key, 45003 has our first global international definition of workplace wellbeing. You can see it on the slide. And you cannot achieve effective workplace wellbeing if you're not managing psychosocial risks. So if you've got an organisation, they think they're great at wellbeing, but they're not managing psychosocial risks, I'm sorry, but you are not great at wellbeing. And it's worth just flagging that the ILO and the World Health Organization have also done a really nice document. They've called it the Mental Health at Work Policy Brief. And they kind of have a hierarchy of action: prevent, protect and promote and support, freely available. A really great little document to supplement what you're doing, both from a psychological health and safety management, but also a more general mental health support point of view. So we're nearly there, because I know we've got some, I'm guessing we've got some questions. So the question in terms of if your relationship with an existing health and safety management system. So 45003 is designed to go with and complement 45001, but if you're using other management systems, the same applies, especially if they follow a plan, do, check, act. This is a quick visual to give you a sense. If you've implemented 45001, you can start to see where you've got a head start in implementing 45003, and where you might need to do more work. So and I'm going to get techie here for speed. Clause 4, actually, that you don't need to do a lot more to make it relevant for 45003. Whereas the biggest areas that you'll probably need to work on will be planning, which is your hazard identification, and then your operation clause 8, which is really your controls. So this gives you a sense, if you've got a really good health and safety management system, technically, although this is a gap globally, a lot of countries have requirements around legislation for psychological health and safety. If you're actually doing that, you should have a lot of this. So you might be much further and closer than you think you are. And If you decide to implement 45,003, what's that return on investment? What's the benefit? So this is a case study from London Luton Airport. They implemented 45,003, and you can see there some of the impact it had. They had a 41% reduction in mental health days lost, 6% increase in terms of employee well-being, and a 30-point increase in their employee net promoter score. So really, really impactful. And I hear that time and time again, and it's one of these standards that really can change the culture of an organization. So it has a huge ripple effect beyond just the, if you like, the direct psychosocial risk management. So just as we're talking about mental health, I just wanted to highlight that we are just out for consultation on a new standard looking specifically at suicide awareness, response and support. We are encouraging people to look at the draft and respond back. You'll have this on the slides. Do have a look at it. It's an amazing standard to support and would build on whatever you're doing in terms of mental health and psychological health and safety. And we have a toolkit available if you want to implement 45,003. I'm not sure that we actually have a poll, but if you kind of respond in the chat, or we can find some way to let you get hold of that planner, should you wish. Whew. Whistle stop tour.
Oh, that was awesome. Thank you so much, Kate. There is a lot there, a lot to go through, that's for sure. But I really appreciate the time you've taken to take us through psychological health and safety, and I guess the link that there is to well-being. I really liked what you said about that. We don't need to be psychologists to do this work. It's actually really an important skill for health and safety professionals to have, and we can't get through this without collaborating with our other people profession partners like HR.
Very
Um,
much so.
we've got so many questions, a lot of questions in the chat, and I've been asking our colleagues if they could vote up the ones that they'd like to hear the answers to.
Okay,
So I'm going to filter them by that.
great.
I want to assure everybody that I've taken down copies of all your questions. We have a public services group meeting next week, so we'll make sure that anything we don't get to is incorporated in our program, or that we can share some answers for you as well. So we'll start with the top two here. So we've got, how do you encourage people to speak up when they disagree with a leader or a peer?
Okay, so this comes back to the culture of the organization, and sometimes that's where we might hear the term psychological safety, which is part of the continuum of psychological health and safety. If you've got to create a culture of trust where people do feel that they can speak up, that they can ask questions. So is there that openness? Is there that culture of trust? If that's not there, then people aren't going to speak up. And what sort of things does that look like? So creating the forum or different forums, because people like to engage in different ways, making sure that the response is curious and open, and that you feed back in terms of what happens off the back of the contribution, because that's often one of the things that happens. So it's a big subject, but fundamentally it comes back to creating a culture of trust.
Absolutely. And the next question we've got is, well, we'd be interested to hear your thoughts on how health and safety and HR should work together to address psychological risks. So this person has seen colleagues who are perhaps health and safety specialists finding HR are actually driving this piece of work, and health and safety is more of a bit part.
Mhm. Yeah, so I think it does vary by organisation. So hmm, this is a sweeping generalisation, but I tend to find that more service-based industries might have a greater lead from HR on this, whereas organisations where there's bigger frontline risk, or greater physical or traditional health and safety risk, it will often be health and safety. But it's, that's a sweeping generalization. I've seen it in both camps. um the key is to get the an integrated working. It may be that one leads more than the other, but you can't do it in isolation. So if it's HR, that might be great for, the majority of psychological health and safety hazards, but what about where you've got this link and crossover with specific health and safety risks? So ergonomics, for instance, if we're thinking about a more service-based, office-based industry, is that being incorporated or is it being left out, and they're two distant things?
The next question we have is a lovely one about engagement. How can organizations effectively assess psychosocial risks in a multicultural workforce? So, considering differences in perceptions and communication styles, perhaps stigma around mental health.
Yeah, so I think it's a really important question, and you do have to take that into account. So this is where kind of talking to people becomes important. So quite often with kind of if you like, a more robust approach to psychosocial risk management, you kind of have a two-stage process. You have a questionnaire which gives you hotspots, and we use the themes of kind of either the three that I've mentioned into 45,003, so the social,
Mm.
the work, etc. And that gives you hotspots, but then you need to deep dive into that and understanding. And I think, areas like bullying and harassment, the expectation and the interpretation does vary depending on where you are in the world. So, and then there might be a piece about understanding what those cultural norms are, and how to manage those.
Yeah, that engagement piece can be really challenging, but really rewarding, I think, when you've got a very diverse workforce. And
Yeah, and I think it comes back to, again, and this links to that first question. It's about creating the culture, and you can't really address any of those without actually talking to people. And the more you talk to people, the more engaged they are, and the more listened to they feel, and therefore they'll be willing to share more. So they're very much interrelated.
I think this next question is quite related to that as well. It comes from one of our colleagues who's an occupational health psychologist, and they're asking about cultural resistance in addressing psychological health and safety. So they've asked, what strategies do you recommend to help leadership teams internalize psychological risk management, not just a compliance requirement, but getting across into that cultural core value space?
Yeah, so really great question. I think it's like a lot of health and safety. It's one step at a time. So, what are the quick wins? What are the things that feel easier or the leadership feel more comfortable about? What are the things that are going to be a bigger issue and take a longer term? So, things like, I don't know, a relationship with noise in a business might be an easier win than looking at kind of working hours in the short term. But again, what are the areas you can do? So if you've got an issue with working hours, actually you might have a short-term challenge in terms of changing that, but you might be able to target the point about, is everybody taking all their vacation time? Because it's very tangible, it's very specific, and it's a clear kind of, actually, a flag that there's an issue. If people are being paid to take time off and they're not taking it, that's quite a big red flag. And it's not too close to home, it's not too sensitive, but it's really tangible. So, again, kind of start to understand what your risk profile is, those hotspots, and then start to prioritize those and think about kind of those quick wins and those other things that might take longer or might be a little bit more challenging.
That's a fabulous answer. I know that I've definitely been in that space before, where going to perhaps your board of management with those words, psychological safety or psychological injury, it can be very scary, and I'm sure even board members get scared. So it's about understanding the language that your senior leaders speak and. bringing it into
comfortable with.
practice. Yeah, yeah,
Yeah,
absolutely.
and I think the other thing is, what understand what their priorities are. So,
Yeah.
I haven't got time to say why approach engagement scores with staff survey engagement scores with caution, but
Mm,
they can also be quite a useful lever for this conversation. Because quite often it's things around career development, and that could be quite a good way to engage with HR. So perhaps sometimes it's about saying, well, actually, they've got a particular focus on staff engagement, or we've got a real issue with recruitment and retention because people are leaving. Well, why are they leaving? Well, because it's not a great place to work. Why isn't it a great place to work? What can we change?
yeah.
They are your ways into some of these conversations.
Thanks. So next question's another really good one. These are fabulous questions, everybody. What are some of the KPIs we can use for psychosocial risk?
Oh,
What are we
okay.
measuring? The Cliff Notes version.
Well, the ideal answer is you want leading and lagging, obviously. So those things that are kind of proactive. That's where engagement scores, if they are asking the right questions, can be beneficial. Things like recruitment and retention rates can be a good piece there. On the other side, then obviously absence rates, especially if you're actually recording whether people are absent with stress or mental health related issues. So kind of the usual suspects, really. But just look at some of the other data that might be there. EAP is anonymized EAP data is often an overlooked one. Really, really insightful. I found if you've got it, and if you kind of get it there. So yeah, look for those different things. And again, that's where that partnership with HR becomes important because they will hold a lot of that data. Well, if they hold it.
That's another thing entirely, isn't it? Um, yes, and I think those are some of the questions that, if our membership is interested, let us know on the public sector group LinkedIn page, because we can do other webinars and community of practice coffee sessions where we can kind of unpick this as
Yeah.
health and safety professionals.
And
Um,
you saw that in the case study with London Luton Airport. They were measuring their mental health illness rates, then they were looking at engagement scores, and then they were looking at overall net promoter scores. So, there are different metrics and things that you can look at.
so the next question we've got an organization that's already certified for 45,001. Is there full certification for 45,003?
So yeah, so it's important to understand. I don't want to get too technical about this. There are different levels of international standards. So 45,001 is the top level, and you get a full certification. Then these sort of next level, which of guidance, which is what 45,003 is, we do a verification. It looks and feels exactly the same as an audit, and you get confirmation that you're achieving and working towards a standard. It's just we can't for reasons and rules I won't bore you with, we can't call it a certification, but it looks, feels, and in context is exactly the same. So yes, there is, to answer the question.
And we've had quite a few questions asking about where we can get some more information about 45,003 and accessing guidance about it. Is it just a case of going and purchasing via BSI, or are there other ways as well that people can get
So
information?
I meant to check actually, and I didn't have time. ISO on their website were offering it available for free to view, but not to download. So the actual kind of standard itself. We've got the toolkit that we've mentioned, which is freely available. It gives a lot more guidance. I've done a number of kind of other webinars and things before, so have a search around. It's getting a lot better in terms of the information that's available. We have some training courses as well. So we have some short courses and some slightly longer courses as well on the standard. So yeah, there's lots of sources of information.
Awesome. Hey, thank you so much. But I'm going to leave it there because we're marching towards 1 o'clock, and I hope everybody, if you're having a lunch, you're getting a lunch, or it might be morning or evening for you. Um, And I just want to say again, Kate, that I really appreciate the time that you've taken to take us through 45,003. All of the questions we haven't got to today, we'll look at as a group and make sure that we get some information out to our attendees. So thank you all very much. There's a little webinar feedback poll and quiz that's just popped up um, in front of you. So if you're participating and you'd be able to fill that in, we'd really appreciate it. And I think we're going to end the webinar there. Thank you guys so much for attending.
Lovely. Thank you, everyone.
Thank you.
Take care.